Hello, everyone. This is Poppy Gerrard-Abbott, and you're listening to the Difficult Conversations podcast, which is aimed at creating less represented sociological and feminist angles to the coronavirus pandemic. Today, we are extremely lucky to be joined by two newly qualified NHS nurses who are working at the beating heart of the pandemic. So I'd like to introduce to you Ella Daniels and Georgia Duffy. Their time, as you can imagine, is very precious. So we are extremely lucky to be having them here with us today. So today we will be exploring the nursing profession in the context of COVID-19 and really zoning in on Ella and Georgia's experiences, observations and reflections. So without further ado, Ella and Georgia, welcome to the Difficult Conversations podcast, and tell us a little bit about yourselves.
My name's Ella. Yep, I am from the south of England and have studied at Edinburgh Uni now for 4 years. Georgia and I are both kind of we're on the cusp of our final kind of few months of studying, but have now opted in to qualify early. So I'm working in A&E now. So it's just been kind of a week, but prior to that, we had already done 6 weeks on our placement. So,
Hey, thanks for having us. So my name is Georgia Duffy, as she's already introduced, and I am from the west coast of Scotland, so not far, where I've just popped over to Edinburgh to do my training. So yeah, we're just in our final year, and we have opted into the Band 4 scheme that started. So we started this week. I am in the Western General, so admissions unit. And yes, I'm just excited to get started.
Fantastic. Thank you. That was a really nice summary of what you're doing right now. And you just say it so casually and you're like, oh yeah, I'm just, on the front line in A&E. It's just another day in the life of. So it's just so great to be having you here. And like I said in the intro, we're just so lucky that you've taken the time, out of the periods of rest between your shifts to come onto the podcast. Your voices are just so valuable to this podcast series. So I'm going to dive straight in with my first question. And as I've said to you both before, this podcast really aims to bring COVID-19 back to the personal. So my first question is, what are the emotional impacts of being expected to go to work during the pandemic? Either of you can go first. Georgia, off you go.
Yeah, I'm happy. Yeah, so this is what I was kind of discussing, in the sense that when I'm going into work, I actually feel almost a sense of calm. It's been a bit of a unique experience in terms of I actually find the emotional side to be more heavy outside of work. So when we go in, it's, I'm not saying it's not horrific and we are treating really unwell patients, but for a lot of nurses, that is their normal, their day to day. So I think they're quite well equipped for that. So actually emotionally in work, it's good. We have a really good team. We're really well supported emotionally. I think emotionally, the difficult side of it is not being able to, hug or touch our hold hands, or when we go home, we can't hug our families. So I think the emotional aspect of the pandemic is definitely heavier when we're not in work, which, seems to defy logic, but it definitely is harder at home. And I think the news is kind of all engulfing, but actually in work, we're kind of well equipped and well prepared for it, I would say.
Yeah, I would agree with Georgia. So I guess emotionally at work, your nerves are heightened because, like anyone who's qualifying in any line of work and starting a new job, you're going to be quite anxious. I guess part of me was a little bit worried that maybe the usual support that we might get as a new starter might not be there, because obviously there are other priorities right now and pressures, and I was worried about kind of getting kind of lost as a new start. But also, so nervous, but also excited, I think, because it's going to be a huge learning experience for everyone. None of us have had to deal with a pandemic before. And it's nice to be part of something so huge. And although it's a big responsibility, I feel like it will prepare us, for other challenges that we face throughout our careers. You do have to be positive, or you'll lose your head a bit, I think. But I'm the same with Georgia, more emotionally impacted outside of work, because just the constant news reports and a lot of misinformation, and missing home and my family. I think that is a comfort that is quite hard to it's quite hard to fill that gap. Sometimes you just need a hug off your mum or something like that, and that's, for me, the hardest part, is probably missing home and the people who usually comfort me when I have a bad day at work, not being able to be with them. So
that's just so interesting, because I think the current kind of journalistic coverage and the narratives around frontline NHS work is very much focused on in a narrowed way on the emotions of dealing with sick people and in witnessing processes of death. But as you have both said there, actually the emotional experience is much broader and relates to things you wouldn't even think of, like being away from home and being prepared for stepping into new roles in your workplace, or moving to a different department. Yeah.
This role that they've created, that George mentioned, this Band 4 role for nurses that were just on the cusp of qualifying, it's such a new role. Nobody has the answers to the questions. The university is still kind of figuring it out. You go into work and the charge nurses are still figuring it out. There is a lot of unknown, and it's, you want to go to someone to ask all these questions, but you're not sure who that person is because nobody has experience with this. And I think that can be quite a challenging thing to kind of come to terms with, is accepting the fact that nobody really knows. Nobody can answer your questions at the moment, and you just kind of have to roll with it.
Absolutely. And I think that also has shown how, I think, adaptable we are. I think because we have gone from placement to placement, and we're kind of almost used to a new area. So I think we definitely have some skills to draw on in that avenue, even though we don't have the charge nurses or the university that know exactly what we're doing.
Yeah.
So just as a kind of sub question, what was the support that you received before, and how has that changed now? So before, were you, say, shadowing and you had a supervisor where they had the capacity to to brief you and to deal with any problems on a very one-to-one basis, and now that's no longer the case? What have been the shifts in support?
Well, so in terms of the practicalities of it, in terms of what's written down in the policy, is that previously we would have one mentor, and that's who we would follow kind of religiously, and they would be our supervisor. However, now they've kind of rebranded the roles in face of the new pandemic, and something has come into force. I can't remember the name, and it basically means that we can be supervised by anybody, including healthcare workers. So we don't necessarily have a registered nurse to supervise us. But what that means is then that certain roles we can't do unless there's a nurse, i.e. giving out medication. But luckily for my personal experience right now has been that there has been enough nurses to continue the mentorship, but this is in place in case there's not.
Okay, thank you. So moving on to my next question, which, forgive me, it's a bit kind of fundamental and philosophical, but is there a better time to be asking these fundamental questions, in the midst of this crisis that we're experiencing, and with everybody kind of going into the home and having pockets of silence where they can perhaps think about some of these questions. So I'd like to put it to you, but take a moment if you need to tune in on this higher level and give an answer that's meaningful to you. So to you, who are nurses? What are they there to do?
So yeah, when Georgia and I we had a little discussion about this question.
Everybody loves to ask this question,
and it's a funny one.
Oh, really? I thought it was
of...
such a novel and unique question. I was like, oh, this is really gonna. They're gonna be like,
normally,
wow,
what
Poppy.
do you think of nurses? Yeah, sorry.
Yeah, and there's a lot of kind of maybe cliched answers we could give, but for me, it's that, you know, a nurse, we're no longer that kind of historical rhetoric of being a doctor's runner. You know, we are very capable individuals that are really at the center of the NHS. You know, we make up a huge proportion of the workforce, and yes, we do a lot of patient care, a lot of medical tasks, but also, you know, we are usually the patient's advocate and their confidant, and you know, those are big, important roles. And yeah, I think in general, you know, we are very caring individuals and very kind, and you know, I hope, yeah, meek is the wrong word, but you know, yes, we have a lot of care and we can be soft, but don't get me wrong, some of the ballsiest, especially females that I've met, have been nurses. You know, a lot of us are very opinionated, and I think that stems from, you know, historically maybe having to really prove ourselves and make ourselves heard. And yeah, I think that's, you know, we're a feisty bunch. That's what I think.
We're majority female. How many people can say that?
And I'm also interested in how these, you know, feminine qualities, perhaps we could label it in that way, these hyper feminine qualities, and also perhaps these more masculine qualities, they don't necessarily have to take oxygen away from each other or be incompatible. They can be very compatible and run in parallel with each other and be re-energized in accordance with whatever the challenge is. So, Georgia, do you want to add anything here?
Yeah, when people ask me this question, I almost can't answer it because I just think of so many things. But yeah, I mean, I completely agree with Ella, and I think that also I think what she was saying in terms of, you know, what we can do, it's right now the kind of another rhetoric is we're heroes, we're angels. And I think, yes, as much as that's a compliment and you know, we like to hear that, and it's people are saying it with goodwill, I think people need, there's a bit of a reorientation need or a bit of education on what we can do, and that it's not an excuse to treat us poorly from a larger, more of the government's perspective. But yeah, so no, I completely agree with Ella. It's a very good point.
Well, yeah, I thought it was like the most novel question ever. So thanks for giving me a reality check there. You're like, no, Poppy, people ask us this every day. Do you still feel like there is this sharp hierarchical divide between doctors and nurses?
It's a funny one, isn't it? It's a funny one because no, it really depends. I think it depends. I've had experiences where I'm working now, actually, A&E, it's a beautiful place to be a nurse because there is so much exposure to different healthcare professionals. The doctors that I'm working with are so keen to teach the nurses, especially the students, and I really feel like the doctors recognise the nurses and how valuable they are. But I definitely have been on other wards where consultants, doctors will walk straight past you or give you a task without even looking you in the eyes. And whether that's because you're a nurse or just because, I don't know what it is, but in your head, you think, well, it's because they're up there and I'm down here, and I don't want to have that. It's not a belief I have, but it's you know, it's part of history, so there must be something in my subconscious that thinks about that. I don't know.
Yeah, I think the hierarchy is inbuilt in it, but like you say, your experiences vary.
Yeah.
Thanks so much for that. Sorry, just a cheeky question on the side. Tell me about the beef between nurses and doctors. Yes.
No, it is a good question because, you know, there is recognition that to do medicine, I mean, gosh, you have to dedicate your life and study for many more years than nursing. But ultimately, it's not about that. When you get into the workplace, you know, doctors need nurses and nurses need doctors. And it's nice when you do work on a ward where both respect each other and recognize each other's strengths. And when that isn't there, it can be really, really hard, I think.
Yeah, I think it's more of a societal divide, I would say, because in the wards, you know, it's not like doctors and nurses, we are one and we all work together. I think it's just in the pay and the way different people view it. I think it's just, but in the hospitals, I think we do work very well together, and you do get the odd divide, but seldom, you know, it's rare. And maybe that's just because there's more females now in the medical profession, but who knows?
Yeah, I actually think that's really helping us, because obviously at one point, the majority of nurses were female and the majority of doctors were male. And I just don't think that helped. That didn't help with the big gap. Whereas now we're seeing more males as nurses and we're seeing more females become incredible doctors. And I do think that is helping level things out a wee bit.
Absolutely.
That's really interesting how those shifts in the gender makeup of the wider NHS workforce and medical establishment have changed things for women in the professions that they've always been in. I find that intersection between the kind of new and the old to be really, really interesting. I actually was planning on looking up the gender segregation in the NHS before this podcast, and I only saw stats on carers and nurses, which is that obviously, as you would expect, they're disproportionately female, something like 70%. But I'm not sure about doctors. I will look that up afterwards.
Yeah, I think it's quite even.
Yeah.
Yeah, actually, I think it's great. I think it is more even than the nursing profession.
Wow. Okay. That is really, really interesting. And how that shapes practice, I think, is a really fascinating subject as well.
Yeah. Another interesting point in the doctor-nurse divide is, like, talking back to, like, historical times, you know, nurses dressed in kind of skirts and kind of motherly figures, like they were there to serve, and the doctors don't wear uniforms. I think that's another kind of divide in clinical areas. You know, nurses almost look like servants and the doctors are professionals dressed, you know, in what they would wear outside or in an office. Not in all clinical areas, but in most.
No, I understand what you're saying there, George. I think that is a point. Like, of course, we need to wear a uniform. That helps us do what we do, but there must be something
it's
in
the
it.
first thing you see,
yeah. You see someone come in a shirt and tie, and they look, or, you know, a suit if you're a female, and they look smart, and, you know, then you might see us in, you know, we're all wearing the same
uniform,
same uniform, and, you know, it's easy to understand why you would trust or go to that doctor maybe over a nurse.
So when a patient is being treated and they have a nurse and a doctor standing in front of them, what are their subconscious and conscious reflections about those people in front of them? And how clear is it to them? And how aware are they that there is this hierarchical divide?
Yeah. But also at the same time, totally recognizing how much work a doctor or a medical student has had to put in. I mean, they dedicate nearly double the amount of time to their studies. Yeah. So obviously, and they have to know a lot. And the decisions that they make, you know, are, you know, they do the diagnosis or they write up the prescription for the drugs, and those can have huge consequences that, you know, maybe a nurse doesn't have to make, and the pressures to do with that. So I don't want to
do their job beautifully. Absolutely.
I don't want to take away from any of the medics, but it's more
just discussing it, raising the points. I mean, they'd be happy to discuss it with us as well. Yeah, absolutely. And the tone that I've always intended for this podcast is one that is very much trying to find narratives that are in the middle and bring together perspectives. So you can say that doctors are absolutely entitled to the status and power that they are given because of this laborious training and because of these profound ethical and medicinal decisions that they have to make, whilst also saying that you think that there is an inequality there within the different professions in the NHS. They can coexist, those two perspectives. Yeah, you're not saying that doctors can go to hell, because or that nurses should receive the same amount of decision making power as doctors. So I think you've articulated that in a very nuanced and kind way. So thank you for finding ways to do that, because that's the kind of language that I think that we need to see at the moment. So moving on to my next question, and this is where I would like you to get a bit political, and of course the personal is political. So again, talk about this in as personal, kind of way as you would like to. Don't worry about judgment or my kind of what I would like you to say. Just speak from the heart. So the public have been clapping the NHS and other workers such as bus drivers and supermarket workers on a weekly basis. So all of our listeners will have heard of the weekly Thursday night 8 p.m. clap for NHS workers. Does this public support match up to what you have both received in the workplace?
No, so I was just going to talk about the clapping bit first, because initially when the first clap started, was it 3 weeks or 4 weeks back, I kind of winced, it made me feel really uncomfortable. I was a bit like, I don't know if that was just the recognition or because it felt personal. But then I soon kind of thought of it more of as a morale booster, people clapping. It was quite nice, and it was more of a sense of community than anything else. So I think it's nice that the public are recognising, the work that all these key workers do, and absolutely I clap too as well now, I love it. And I think the support from the public is great, and it's been really nice, we've been getting lots of support in terms of discounts and things like that. Not that matters, but even just the recognition. But in terms of the workplace, I would say that we definitely are supported emotionally, just in the teams that we're in. And we're lucky, Elle and I, that we're still kind of in conjunction with the university, so we have that line of support as well. But I definitely think we don't have the government support in the sense that, it's different in Scotland, it definitely is different here. You're definitely more unique. But it's more been a long-standing lack of support than now. Now everybody's coming out in support, but it's not always been like that. So I would say yes. So in conclusion, I would say that we are, we basically, the support is coming now, but I just feel like it's not been here the whole time. Where has it been? The job isn't any more different. People are just now affected more personally by it.
Yeah. So I feel like we're on the cusp of kind of two workplaces at the moment. We're still kind of got one foot in the door with uni and one foot in the hospitals. And I must say that I feel like the health and social science department at the university have been great. A few individuals, especially, just so quick to reply to emails, constantly updating us with kind of advice and signposting, us to services. Sarah, shout out to Sarah. And, it's lovely, they're telling us they're really proud of us as a year group, and that feels really good. We did have I hope I can say this, we did have a little laugh as a year group the other week. We've got like a little chat that our nursing group has, and we were laughing about how the university posted a statement a few weeks ago saying how proud they were of their medical students who were volunteering. But at this point, the nursing cohort had been on placement in the hospitals for 6 weeks already, so that's full-time unemployed work. And, it makes you think about that rhetoric, and you're like, well, why are the medical students getting recognition, and we've been on the wards for 6 weeks full time, not getting any pay. To be fair to the university, they did release a statement recently saying, they were proud of us, which was nice. But that was quite funny. Yeah.
Yeah. Because we're a small cohort.
Yeah, we are. In terms of the workplace, I think it's quite dependent on what ward you're on and the pressures on that ward, and whether they've got time to kind of focus on supporting you. My personal experience has been quite positive. My charge nurse on A&E has, sat us all down and told us what's to be expected of us and what is there if we need support. But me and Georgia were discussing this, and it's kind of that thing, in a lot of jobs, they say to you, if you need time off, take it. And we're here for you if you're going through a personal experience. But I do always question,
does the environment facilitate that? Yeah.
Yeah. What would happen if you did go into work and say, I need 2 weeks off because I'm not doing well, or this is too much to me? And whether you could do that without going home and worrying about repercussions, or if people are judging you. And
I wonder if that's a personal guilt we put on ourselves as opposed to the environment, because we almost don't want to be unwell or to do that, or if that is a product of them not being supportive enough to make us feel that we can, phone in sick or take a day.
Yeah, definitely.
That's again another byproduct of being understaffed and under-resourced.
Yeah, I think it's to do with that. At work, we're a big team, and it does feel supportive. All of our colleagues are supportive. But when it comes to the government, it just feels a little bit like, I don't want to be too political, but a little too late. You've got ministers and people clapping who are partly responsible for not the pandemic, but for
being underprepared.
Being so underprepared. And you can't help but feel a tiny pang of resentment when you see them clapping and you see their pictures in the news. Look at so-and-so supporting the NHS staff.
Yeah, and I think that's a lack of accountability as well, because, they're all in it together. So it wasn't them personally, but it wasn't a direct result of that one individual, but they were part of it. But I don't think they necessarily recognise that. And nobody has taken that accountability.
Yeah.
Yeah, I guess the critique of the weekly clap for NHS and key workers is that it is this state-endorsed exercise that is just giving workers a well done, whereas what they need in reality is a properly funded NHS, PPE, a government that is pro-NHS and keeps its original founding principles alive and funds it properly. At the moment, I have a sign in my window that I would be interested in your thoughts on. So it says, don't clap, pay NHS. I'm interested in, just briefly before we move on, do you think I should take that down?
No, Poppy.
No, I definitely agree with it. I also kind of think, like you were saying earlier, I think it's fighting fire. I think we could do both in conjunction. We could clap and they could fund us. Because I think what I'm trying to disassociate the clap with is more of a morale booster as opposed to a thank you.
Yes, this is what a colleague said to me when she saw my post about the sign on Twitter, and I had loads of people that were very supportive, but she said, well, I think it's possible to do both. And I absolutely hear and see that argument. I guess my concern is that the clap find that there's maybe a patronizing undertone to it, and having kind of grown up with a mum who spent 45 years working in the NHS. She's now in her 60s, and she started her career as a nurse when she was 17, and we grew up with barely any money, and so I almost feel like it's a very personal sign, and it comes from a place of being like, well, F your clap. I want my mum to have been paid properly for all of those years that she worked, and as you were saying, you articulated very, very well, Ella. There are people who are going outside their homes and clapping for 30 seconds on a Thursday night, and that sentiment is not reflected in where they put their X on their ballot. So I hope that makes sense. And I also thank you so much, Georgia, for bringing that balance and that nuance. I completely see that argument.
I think it's difficult to describe a meme, right? But it, in my opinion, perfectly answers kind of what you're mentioning, Poppy. It was a picture. If you imagine someone drowning, right, and they've got their hand coming out of the water, and that is the nurse, and then there is another hand reaching down to the nurse's hand, and that's the government. And it looks like the government is about to drag, save the nurses.
Oh my God, yes, Ella, I saw that meme yesterday. As you described it, it just jumped into my mind. I know this meme. It looks like the government is going to save the drowning nurse and pull them out of the water, but instead they high-five them, and it's meant to illustrate the sentiment of the clap. I might put that meme as the podcast cover, or link it into the bottom of the podcast episode just to see what people think. So listeners, do you agree with the weekly clap? Let us know.